Hi guys, welcome back to my channel. My name is Khadijat Adeshola, and in my channel I talk about everything related to women and midwifery. So today I'll be talking about my labor and birth experience. So this is just a personal story, and I am sharing this because a lot of people ask me, especially the those ones that the primary, yeah, I would say it that way. The primary, maybe those are expecting pregnancy or they're already pregnant and it's their first pregnancy. They're asking me, how were you able to, how was it? That was the question. That's how they put it. How was it? Tell me, how was it? So it's like, I think it would be best for me to do a video. So once anyone asks me, how was it? I'll just refer them to the video. Then also, if I do some videos as well, it's not easy for me to share to people if it's not on YouTube. So I find it difficult to really share my videos that are not on YouTube. So I'll be making some other videos as well. So you just definitely watch the one that is beneficial to you. Okay. So my labor and birth experience. If you've not subscribed to my channel, please do that now. Please help me to grow on my channel so YouTube will recommend my videos to people looking for this kind of information, the kind of information I share on my channel. So my labor and birth experience. I had my baby at 40 plus 1 day exactly. So I have shared about my pregnancy before, so you can my pregnancy and work experience. I've shared that on my video, so you on my channel, so you can check the video out if you want to know about that. So of course, we know baby is term at 37 weeks. So from 37 weeks, your baby is okay to be born. So from there, you'll be expecting some, some labors and all of that. As a primary, sometimes they did say you start feeling braxing, each contraction, which some people call forced contraction, forced labor or something, from 36 weeks. I do not feel anything in my own case. Yeah. From 37 weeks, nothing. 39 weeks, nothing. So at 39 plus 1, I went for a mini vacation. With my husband. We went to Brighton. I was already, at home. I wasn't working at that time. I was already on leave, on annual leave. So I worked till 37 weeks, and I had annual leave till 40 weeks. So my maternity leave starts on, when I was 40 weeks exactly. So I went on a mini vacation to Brighton. So I'll be sharing some of the videos. Brighton is a nice place of vacation in case you want to go. We lodged in an hotel very close to the seafront. So it was Holiday Inn to be precise. It was a nice one. So we were lodged in front of the sea, the sea, yeah, the sea. So getting to Brighton, if you've been there before, the sea is a very long walk to walk through the sea. We were not even able to, walk all the way. So we basically walked from the Holiday Inn. We walked down to Brighton Premier Palace or something. Yeah, I don't think I take a picture of this. I'll put that as well. So we walked down there. So if you know the place, you know that it's not really a small walk. So we walked there when we get there on Saturday evening, because check-in was 3 o'clock. We got there before 3, maybe like 1 o'clock. So we had to, just walk around, have some meals and all of that. So we went to, some of the places to eat and we walk around. Then we walked back to the hotel to check in past 3. We had some rest. Then we went back out to walk around the sea again. So that was like a two times we worked there that day. Then I got back home in the night this particular day. That was the first time I started feeling the Braxton 8 contraction. I know it is not labor contraction. I'm a midwife. I know, it should be, more painful than this and more frequent. So I was only having like one in 10 minutes or one in 20 minutes. It wasn't really, strong or long. Let me say like lasting just like 20 seconds. I already know it's that Braxton 8 contraction. So I started feeling Braxy 8 at 39 plus 1. So in the UK, if you're a low risk pregnant woman from 40 weeks and you're not in labor until 40 weeks, your midwife will offer you stretch and sweep. It is an offer. It is not compulsory that you get it. Each trust they do offer induction of labor, but they have policies on when they will offer you induction of labor. Some will offer you pregnancy is not allowed to exceed 42 weeks. So some will offer you induction of labor at 40 plus 1, plus 40 plus 3, or 40 plus 5, depending, or 41 weeks plus 1, 41 weeks, or 41 weeks plus 5, or 41 weeks plus 3 days. So it depending on the trust policy. And also that is for low risk pregnancy that you do not really have any risks. So I was already offered induction of labor for 41 plus 3 weeks, 3 days, because that's what my trust does. So at 40 weeks, the midwife will offer you stretch and sweep. The stretch and sweep is a kind of stimulation. Sometimes it do help to stimulate contraction and you fall into labor. And sometimes it doesn't add anything. Yeah, you still don't go into labor. So it depends on how your body is reacting to it. They do offer from 40 weeks, really. So I have appointment with my midwife on Friday, which is I'll be 39 plus 6, yeah. After the contractions, the tightening I had on the night of 30, 39 plus 1, the next day we still had some kind of work, so I still feel some of those tightening. Then when we come back from our vacation, all of it stopped because I didn't work that kind of much again. So on at 39 plus 6, I went to my midwife for my regular appointment. Then I requested to have a stretch and sweep. So the midwife told me that they don't do the stretch and sweep routinely if I'm less than 40 weeks. But I requested for it that I just want to know what's going on because I'm not feeling anything. So I know the cervix will not be dilated anyway, but I want to know how long it is, if it is soft or if it's still firm. So these are just criteria that will give me an insight that whether I'll have much contractions, I have to really have a strong contraction for there to be difference in my cervix, or even if I have a little contraction, it may make a difference in my cervix. This is just for me to know the state of my cervix. I'm sure the midwives here will understand what I'm saying. Yes, significant percent of people here are women anyway, and the midwife will understand what I'm saying. So I only requested for the stretch and so for me to know the state of my cervix. In my head I know my cervix will not be dilated. This is my first pregnancy and I have not been feeling any spontaneous contraction, so I do not expect my cervix to be dilated. Yeah. About the VE, I was worried about it because I know it's quite painful or discomforting. So I made up my mind and just hoping I'm able to cope with it. Fortunately enough, the VE wasn't really, painful as much as I expected. Maybe the midwife was so calm enough, anyway. And I requested for it. So I have to be of the best behavior because I actually requested for it. So I don't want to make my midwife to have some kind of feelings and all of that. Bring her fingers how it was already staying with blood, what's it called, show. I was like, wow. So she said, get what it is. It was like 2 centimeter dilated and it's very stretchy and soft. So that's basically what I want to know. And your membranes were bulging. I said, just leave the membrane there. Yeah. So after the stretch and sweep, I got home on that Friday. I started having tightening. This shows that the baby is reacting to the stimulation. So I started having tightening, but that was in the morning. The stretch and field appointment was around 11 o'clock. I usually have my appointment around 11 because I need to sleep. So I started having tightenings. My husband was at work, so I had to call him that okay, if this pain continued this way, If it become more painful, I may need to go to the hospital. I had it throughout that day till 9, then it stopped. I didn't have anything on Saturday. So what they do is at discretion, and sleep, they offer it every 48 hours for 3 days in a week. Then they give you 1 week interval, 1 week break. Then they continue next week if you've not had any, if you've not gone into labor. This is for my trust. I don't know of any other one. It may be the same thing or similar. Just stress check your policy, especially if you're a community midwife. So my 48 hours will be on a Sunday. So I had another appointment on Sunday. That Sunday I will be 40 plus 1 on that Sunday. The appointment was meant to be 9:30. I got there, the midwife, I wasn't seeing at exactly 9:30. I was seeing around 10 o'clock. They did instruction sweep and the midwife did say the same thing. But the thing is that my baby has been engaged since like 36 weeks or so. Yeah. So the head was very down and the membrane had been bulging. My brain did not burst, but it was bulging. Maybe probably because I wasn't feeling any contraction. After the tightening on Friday, throughout Saturday, I didn't feel anything. I was expecting that I would feel something on Saturday, but nothing. So basically, when the stimulations wears off, and that is it. When they do VE or stimulation, sometimes there's release of prostaglandin. So this prostaglandin helps stimulate, oxytocin and all of that works and contraction. So probably after all of that wear out, that was when the contraction stops. So on Sunday, I went for the appointment as usual. The midwife still said the same thing, and I started feeling the tightness just as usual before. So what do I do before going for the appointment? I walk to the appointment. I live in a staircase, so I walk down the staircase like 10 times before going for my appointment. I think that was when I came back anyway. When I went for the appointment, the midwife did say the same thing, and I was disappointed that it's still the same thing. So I told my husband, they said it's still the same thing. Of course, I started having the same tightening, just like Friday. I was like, okay, that's fine. So I do support people for OSCE, right? So I have some people I do train for OSCE. I do, have appointment with them. So I was supposed to have appointment with this lady on that day, on that Sunday, which I will be 40 plus 1 by 11 o'clock. I was still having some tightening. I still call her by 11 o'clock. Then she told me to give her like 1 hour. So around 11 o'clock, I feel like eating plantain. So I went outside to the African store to get some plantain, to get, indomines and some things. I got back home. Actually, there was yam as well. I couldn't carry the yam. I told them I cannot carry the yam. I love the yam, but I cannot carry it. I was just living 5 minutes away from the place. So the person offered to help me because he has a boy in the store. So the boy helped me to bring the stuffs to my house. When I got home, I ate because I already put the spaghetti on the fire, you know, spaghetti. So when I come back, the spaghetti has already done, was ready to, to be served. So I only fried the plantain and I was eating. So as I was eating, that was like to 12. I started feeling the first strong contraction. I was like, wow, no, this is different. Yeah, this is definitely, the contractions, labor it's become more stronger, more painful and increase in intensity and in more longer. So I was forced to count my contractions. So eventually, after that, I was hitting when that happened. Then I still continue. Then the person I have appointment with called around that 12 o'clock. And I told her I can only do like 30 minutes because I was already having that strong contraction at that time. We started like past 11 anyway. So I told her I can only do like 30 minutes. So we do that for like 30 minutes. Whenever I have contraction, I make sure it's like when she's talking anyway. So I only, because it was just like revision stage we were just doing because our exam was closer as at that time. So what I do was, after then I started counting the contraction. When the contractions come, really, I feel like I needed pain relief. I already planned I will get pain relief in my labor. Yeah. When I will get pain relief will be when it become more painful and I can't bear it. That was my plan. Whenever it become more painful and I can't bear it, I will request for pain relief. Yeah. So I already planned. I don't like taking medications. I already planned I'm not taking paracetamol. because it's big. Codeine tablet is small, but I'm usually constipated in in pregnancy, and I know there's probability that I will be constipated. So I made up my mind I'm not taking codeine. I don't like gasoline, so I know it will make me feel nauseated. I know I'm not taking it. So I plan to take only petidine injection. So at that time that it was painful, I said I needed pain relief. My husband was at home, so I had to call my husband to eat because I know when we get to the hospital, then he will not be able to eat what they will serve anyway. Then also they did the VE at 10 o'clock. I was like, okay, we do VE for hourly. Let me wait like until like 2 o'clock. When it's 2 o'clock, it will be 4 hours from the previous one. At least they will be able to examine it. And I want to really be in active phase of labor when I go into labor, go into the hospital. I don't want to go into the hospital where they will say I'm still 2 centimeter as as usual. So I counted my contraction. It was 2 in 10. Yeah, but it was long. I counted up to 40 seconds. So I know it was a strong contraction. It was still continuing, but I know, yeah, 40 seconds, above 40 seconds is a strong contraction. So it's okay for me. I counted 2 in 10. Yeah. Then later, it becomes like 3 in 10. It wasn't really three because the third one started at exactly 9 minutes. So it was like 2 to 3 in 10, really. Then, as at past one, my husband was still eating. Whenever I have the pain, it's really strong that I really, really need pain relief. I need to go to the hospital. So I went to my bathtub and I was telling my husband to eat. So after eating, I will call the hospital. And I was in my head waiting for 2 o'clock as well. At one point, I think I cannot bear it. I need to go. So I asked my husband to give me my phone and I called the delivery suite and they asked me to come in. So we actually called the taxi at 13:57. Yeah. The taxi was like, okay, now taxi maybe 5 to 10 minutes or so before they get to the to your side and all of that. So when the taxi came in, and then whenever I have that contraction in the taxi, my home is just like 7 minutes drive away from the hospital. But whenever I have that pain, I was really, really uncomfortable. So the taxi man was like, okay, you have to take like, just find a way of doing it to get to the hospital, as fast as we could. When we get to the hospital, I walked down to the triage and I was like, now it was where I was working. So they were like, Khadija, when did you start feeling these contractions? I was like, yeah, when did you, how are you? Are you maybe suitable? I say, yes, okay, we will triage you, this and that. When did you start feeling contractions? I said, like, just like 3 hours ago, because it was like 11 and I got to the hospital like before 2 o'clock. So just like 3 hours ago, right? 11, 11, 12, 1. Yeah, I just said like 3 hours, sharp, but it wasn't really up to 3 hours because it really started at 11. I remember I was outside. It wasn't painful. It started being that painful when I started eating, and the whole thing actually started after the V, which was 10 o'clock. So everything was still not up to three. It was not more than 3 hours at the time. So then the midwife was like, okay, now they have to triage and all of that. Then I had this contraction again. When I shouted, then they were like, no, 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 we need to really, triage you. There was a patient sitting there. She actually helped me. And they told the patient I was a midwife because she was wondering how I was chatting with the midwife like that. So she was wondering, how will you be chatting to a patient this way? Then the midwife have to tell her that I am actually one of the midwives. So the patient helped me as well. She was rubbing my back because as at the time my husband has gone to take my files, so she was rubbing my back and I was taken to the bed. And I was taken to the bed, they were asking me, Khadija, just tell me, when did the pain start? I was like, no, I wasn't. That's when the pain started anyway. So she did a VE and she was like, I was like, I need a pet. They asked if I need entonos. I said, no, I don't want. I just want petidine. For petidine, yeah, it has to be prescribed. It's a controlled drug. He has to be prescribed, and they needs to really know the state of my baby before really giving petidine, and they needs to know how dilated I am, because if you're very close to delivering that baby and you take petidine, the baby might come out being flabby because petidine actually depresses the respiratory system. So it really, really might affect the baby if the baby is already close to coming. So she did examine me. She said 6 centimeter, and then I asked her, "Can I still have petidine?" She was like, "Yes, you can have it. You don't want codeine?" I said, "No, I'm constipated." "Have you taken anything?" I said, "No." "Try Gasanet." I said, "No, I will feel nauseated." She was like, "Okay. Guess how many centimeter you are?" I was like, "I don't know, but I know I should be in active phase of labor." She was like, "Your 6 centimeter membrane is bulging." Okay, I said, "Okay, that's fine." So there was another lady that they needs to come and to pick for to go to the delivery suite. So I was being prioritized because of the state. I think I was more dilated than she was, and they said membrane was bulging. So they brought a wheelchair for me to go to my room. I was like, I can walk. There was nothing wrong with me. It was only when I have contraction that I'm actually uncomfortable. And my contraction are well spaced. So I only have like 3 in 10, which means that maybe it may be lasting more than 1 minute. I don't really count that, but at least like 3 in 10. It means I have space, like at least 2 minutes or 3 minutes, 2 to 3 minutes in between the contraction. I have like two minutes in between the contractions. So that's enough for me to walk down to wherever I'm going. They were like, "You're going to the father's room." I said, "Where it is?" They said, "MLBU 4." With the way my hospital is built, that's actually the farthest place to the triage. I said, "Okay, no problem. I'll run down there before the next contraction starts." And you know the hospital, you have to go in with your wipes. I didn't since I started being on leave, I drop all everything that relates to the hospital. So you wouldn't even know I'm working in the hospital anyway. I don't have anything that really says that I'm working in the hospital. So I could not really get in. I was like, "Oh, can I get someone to wipe me in?" So there was somebody that was ready to go in. The person wiped me in and I went in. I got stuck in another place, which is like the entrance to the MMBU. MMBU means midwifery led betting unit. So to the entrance there, I was stuck again. Then some people was like, "Who is this? Is that Khadija?" I said, "Yes, that's Khadija. Can you please let me in?" So I wasn't this calm anyway. So they let me in. I got into the room. I just took my gown off and I was like, "I needed petidine. I want petidine." I was shouting, "I needed petidine." They were like, "Okay, somebody is getting it." Meanwhile, in the triad, I already told them that, "Can you please call one for, can you please call the doctor to get me petidine? Can you please beep the doctor to prescribe the petidine?" They were like, "It's already been prescribed. It's already in the room." I was like, "How can petidine be in the room? It wouldn't be in the room anyway." They said, "Oh, someone has gotten it." So they mentioned the midwife, that the midwife has gone to get it. I said, "Okay, that's fine." I got into the room. I was like, I needed the petidine. I actually ran, there. The midwife couldn't really pick up with my pace because I was trying to run so I will get to the room before the next contraction. So when the midwife comes in, and in MLBU, you have to listen to baby every 15 minutes. So she was waiting to listen to my baby. She was actually listening to the baby. And I said that I'm having contractions. Then another contraction started, and I told her that I want to go to the toilet. I feel like pooing, and I'm already weighing on my body. I need to go to the toilet. Then I feel like I want to push or something. She was like, "Yeah, you can push." I was like, "What?" "I can push." When she said, it was a different midwife that examined me. It was a different midwife. The triad midwife was the one that examined me. Then the labor ward midwife was the one that I'm talking to now. She said, "You can push." I was like, "How can you say I can push in my at 6 centimeter? Who does that?" Anyway, I need to go to the toilet. Then when I got to the toilet, I put out my bag. I wanted to pee. Then I saw something coming. Like, "What's that?" She actually put her hands on that, and it was actually the baby head. The vertex was visible. And it was like, I was like, "What's that? Is that my baby head?" And she said, "Yes, that's your baby head." I was like, "What?" Then she said, "Okay." Then the contraction stopped. So, I said that I really have good space within my contractions. So she was like, "Yes, it's your baby head." So she has to, without gloves. So luckily, she has a student working with her. The student has already been preparing for the delivery, because I don't know what information the other midwife gave them in the triad, but they already preparing for the delivery. I was like, if I was 6 centimeters, I was bringing the delivery trolley inside the room by now. Anyway, she used her finger, her palm, to actually take the baby, without gloves and everything, because the vertex were really visible. So she had to support the baby with one of her, with her palm like this, and use the other hand to support my back. Guess where my husband was? My husband was there just looking like, what is going on? Really? Like everything is magic. So when I got onto the bed, with the next contraction, guess what? My baby head was delivered with membrane. Yeah. That's my baby, my precious baby. Yeah. She was delivered with membrane eater. I was like, what? Yes. A baby come with a membrane. So I said earlier that my contractions are usually, spaced, and they were, it takes time before the next contraction. And whenever the contraction stop, I don't really feel any urge to do anything. The contraction were the one that are actually explosive in nature to really bring the baby hand. Yeah. When the baby head was delivered, there was no laceration because I couldn't feel anything really. Yeah. Now, they burst the membrane. With the next contractions, guess what? My baby was fully delivered and I had this tear. Yes, I felt it. It was like someone used blade, to tore me. I felt it. It was a media tear. I could feel it myself. Yeah. Because it was like the pain was different. You know that yes, this is tearing. For me as a midwife, I know that yes, that is a tear. It was delivering of the baby. Sometimes that is the mistake that we do. We rightly guide the perineum. We do the OSI, obstetric clinical OSI. We use the grips, finished grips, to deliver the baby head. Then we forget to continue guiding the perineum because of the shoulder. Most of the time, it is actually the posterior shoulder that give this perineal tear. So as a midwife, after you conduct the delivery of the baby head, please don't remove your hand from the perineum. Still continue guiding the perineum, because sometimes you achieve an intact perineum at the delivery of the fetal head, but the posterior shoulder eventually give you this second degree tear. I had a second degree tear, and it was the posterior shoulder that actually tore me, and I could feel it that it was actually because of the guiding. Maybe probably after the delivery of the baby, they already removed their hand from the perineum. They was just happy that the baby has been delivered. Don't forget that there was a student in there, and the delivery was, when you have a student, you have to be like, there will be instruction. And the way my delivery was as well, it was kind of emergency as well. So I am not blaming anybody for my tear, really, but I'm just telling you as a midwife, try as much as possible not to forget to continue guiding the perineum even after the baby head is being delivered. Just that, because you might achieve an intact perineum to deliver the baby head, but the posterior shoulder will still cause a kind of laceration for the woman. Yeah. Then after that, yes, the baby was delivered, and I was expecting my baby on my tummy, and I didn't find my baby on my tummy. I was like, where is my baby? My baby was fine. My baby was moving. Yes, my baby was moving, and my baby FH was fine. Where is my baby? Then they were like, okay, your baby had cord around the neck twice. So they were trying and insert, and they were trying to or not remove the cord. That was why the baby was not, on my tummy. Then immediately they removed it. They started just the tactile stimulation. Then the baby cried. So my our baby have got at 1 minute was still 9 minutes, nine, yeah, was still 9. But because of the cord, they had to remove the cord, yeah, and give a kind of little stimulation. In all of this, I closed my eyes. Yes, I don't want to see anybody, but at least I know everything that was going on. I was being communicated to. They told me everything. Okay, your baby is delivered. The membrane was still intact. Okay, so now the contractions is not coming out. I'm going to burst the membrane, and I actually felt it when it burst because the water, the warm amniotic fluid fills all my body, and I feel that warm. Yeah. When my baby is delivered as well, I know when my baby was delivered. I was communicated to. I was taken throughout the process. Yes, and my baby was put to my tummy eventually, and the rubbing and all of that take place. Every other thing takes place. I was not able to give the consent for vitamin K active management of labor because I was not really being managed in labor. So they gave they asked for my consent after the delivery of my baby. And of course I say yes. I wasn't even expecting them to ask. but they do ask really. So I gave my consent for them to do active management of third stage of labor. And I also gave my consent for them to give my baby vitamin K injection. Yeah. They do all of that. Now, of course, the membrane was delivered as well. Yeah, the placenta was delivered. Sorry, the placenta was delivered. I think it was, yeah. And after delivery, now he has to do the suturing. I know that's where the problem is. Remember, I do not have any pain relief to the delivery of my baby. I know it's going to be painful. So I already told my midwife, yeah, I won't be a good patient in your suturing because it's going to be painful. Everywhere is sore already and all of that. Yes, she gave me xylocaine, and I didn't really feel it when she was suturing. I only feel a bite, like a stitch, when she was almost done. And I shouted, then she gave me another xylocaine. Yeah, that was all. After the delivery, yeah, I was fine as well. So in all of this, I just say there's one thing I used to say, Alhamdulillah, because I know that it is just Allah mercy. It is not that easy for some people, but Allah has make it easy for me. And I pray you that you are pregnant and you don't really know how it's going to be. I pray Allah make it easy for you as well. Then before my baby, do I have a plan? A best plan. I was asked about best plan because people do make best plan here. But one thing as a midwife, what I realized that sometimes what you plan does not really happen. It doesn't always go as you plan. So I do not really have a plan for my delivery. All I wish for is that Allah should make it easy for me. I'm a Muslim, yeah, you know. I don't really talk about religion really, but in this case, because I'm talking about my experience, a lot of that, and this also is a reflection of how I was able to go through everything. So I do pray for Allah to make it easy for me. I do not really have a plan or a bet wish. I just say Allah should make it easy for me because nothing is absolutely easy except what Allah make easy. And I can say today that Allah has made everything easy for me, both my pregnancy and my delivery, and even at the moment. So Alhamdulillah for that. So after my delivery, I did not take any pain relief as I decided. Okay, yeah, I asked them to give me rectal diclofenac because I don't want to take anything in my mouth. So they gave me rectal diclofenac immediately after the suturing, and that was all for that day. I qualified for 6 hours post delivery, probably because I'm a midwife. Because normally this is my first pregnancy, they might ask me to stay 24 hours, but because I was requested to, I know I can have a 6 hour delivery because I was fine, everything is okay. But they do night P here, and they was on a Sunday. There was nobody to do night P, so I had to wait. I was like, if I go home that day, I'll have to come back the next day for my night P. So I was like, no, I'll wait till tomorrow for my night P. Then after the night P, I will go home. Yes, so I was discharged less than 24 hours after my delivery. So that is my, labor and birth experience. So the midwives, what will you say? What type of delivery will you say, labor do you say I have? Well, if you're watching, you already know I had a precipitated labor. How you say? Because as at 10 o'clock I was examining, I was still in latent phase of labor. It's like I wasn't in labor and I was not contracting. So everything happened. So when did I deliver my baby? Did I say it? I delivered my baby at 15:20. Sorry, yeah, 14:29. 14:29 is 2:29. I called the 30 at 13:57. That's to 2. So within 30 minutes, I delivered my baby. So on getting to the hospital, in my birth summary, the whole labor time was like 19 minutes. Yes. Yes, first stage, second stage, yeah, second stage, first stage, that summary was just like 19 minutes. It means that I delivered my baby within 19 minutes of getting to the hospital. Yeah, that's when I delivered my baby. So everything lasted for just like all the whole process of contraction. Even if I counted from 10 o'clock that I got to the hospital, which it wasn't really the case and all of that. When they do the V in the morning, that it was 2 centimeter, 2 centimeter, they can stretch it to 3, just say like 2 centimeter. I wasn't really feeling contraction. Let's say I felt contraction for like 4 hours. So that's like a precipitated labor. It was my first pregnancy, so there was no influence of, oh, she's gravid or something, and it wasn't really that contraction. So I will say that I have a precipitated labor. I didn't take anything. Yeah, no pain relief, no oxytocin, nothing. It was just not natural. This was because Allah made it that way. Yes, during the process or delivery, if I have a reason to do a cesarean section, I will not object it. Yes, because I already left everything for Allah. I say Allah should make it easy for me. So if that was the way Allah wants it to be, yeah, I would not object that. So that was my experience. If you enjoyed this, if you want to know about, I've talked about pregnancy, I've talked about labor and birth, it's remaining the postnatal, right? And my baby, I was coping with that. If you want me to do a video about that, please say that in the comment section. Don't forget to share this video as well. If you are in the stage of pregnancy, or you just got married, or you are women, please, I will say you should subscribe to my channel, and please share my videos to other people as well. Thank you so much for watching. I'll see you in my next video.